A confirmed case of measles has been reported in the city of Milwaukee.
Milwaukee health officials are trying to identify people now who may have been exposed.
And bad news for Badger fans. Quarterback Tanner Mordecai is recovering from surgery for a broken hand. He'll be out. Will he be out for the season?
Yeah.
Lots to talk about. Here's UW Health's Dr. Jeff Pothof joining us once
Dr.
again.
Pothof?
Hey, guys.
Measles, big deal.
You know, it is kind of a big deal. A lot of us don't worry about measles. It was nearly eradicated here in the United States with the MMR vaccine. We had achieved true herd immunity, but we've lost a little bit of that. There's a lot of individuals who've chosen not to be vaccinated, and when we see measles in the community, the thing that worries us is it's really contagious. About 9 out of 10 people who are exposed to it will come down with it. So it's dangerous for those who are not vaccinated against the MMR, but then also those who are immunocompromised, much like COVID, those who maybe had solid organ transplant, or they have cancer, or maybe they're just older, their immune system's not that great. They have some risk when they come in contact with someone who has known measles.
And this is through the air?
Yeah, it's through the air, and like we mentioned, like very, very contagious.
The City of Milwaukee Health Department issued a pretty detailed press release about where this individual had gone in case anybody had been in the same vicinity. You could very easily have an outbreak if there aren't enough vaccinated people.
Yeah, exactly. And then what they don't want is this to like reproduce through multiple generations. So you have this one person, and then you want to find anyone that could have been in contact with them and make sure that if they come down with symptoms, you isolate them, because then you don't want, let's say, the 5 people that come down with it to go on and to infect 5 more. You can see how it could become a big problem pretty quickly. So it's a pretty common public health strategy, is like really try to let folks know that they may have been exposed. So if they come down with symptoms, they're less likely to pass it on to more people.
What are the symptoms?
So lots of times it'll start with fever, and then you'll get conjunctivitis, so inflammation of your eyes. You'll get a really stuffy nose, some watery nose, some malaise. That happens about, on average, 13 days after exposure. And then a few days after you get those symptoms, you'll develop that rash. Before that, you'll get something in your mouth called Koplik spots. Doctors know to look for that, but that rash would be kind of the telltale. Unfortunately, you're contagious for 4 or 5 days before that rash develops.
Would a vaccine help now if you got it?
You know, probably wouldn't hurt if you're not vaccinated against measles, mumps, rubella, and you're like, man, I don't want to take my chances. Getting it now, depending on when you'd come in contact with measles, could protect you, but certainly it would protect you for the next time there's a case of measles. We see this every couple of years, it seems, where there's like a concern for measles outbreak.
I think our generation's all pretty much immunized with that.
Yeah.
We had smarter parents. All right, let's go on to a quarterback's broken hand. Yeah. Is he out for the season?
You know, there's a good chance. Now, I don't know the full details of the injury, but one of the things that we did hear was that they pinned the fracture. So typically when you pin the fracture, that means that when you tried to arrange the bones and hold them in place just using a splint or whatever it may be, it didn't actually work that well. There's a little bit of displacement there, so lots of times they'll have to pin that. They'll also pin it if it's getting close to or is in a joint. When you start looking at that, usually recovery time is somewhere at least in the 8 to 10 week range. And then you got to have the physical therapy to get your hand in condition to throw a football at a D1 football game.
Is it his throwing hand? Do we know that?
I think
it was.
Yeah.
Oh,
8 to 10 weeks, that's the season.
That's the season, yeah. And then do they take the pins out?
Oftentimes they will take the pins out. Not 100% of the time, but oftentimes they do.
Let's talk quickly about COVID vaccine availability. Things are getting a little better?
Yeah, I think it's really getting pretty good. Still a little bit of shortage this week. I think by next week, for the most part, folks looking for a vaccine should be in that spot where they should be able to get it relatively quickly, kind of wherever they want to get it.
And flu vaccine is in pretty good supply.
Yeah, no problem with flu vaccine, easily available.
And how about RSV? Same with
RSV, not quite. You got to talk to your primary care doctor, see where it's at, especially that vaccine for pregnant women to protect their kids the next year. That one's a little bit short yet, but talk with your docs about that one. That one's still a little bit short.
And get them both at the same time?
I think it's easier to get them both at the same time. Like, who wants to go and get shot 2 separate days?
You went today.
Get 3?
You know, you probably could if...
You can get 4.
You probably can.
Yeah, your husband got 4.
Yeah.
Right?
Yeah.
Wow, poor guy.
He was out.
Yeah.
And you got yours today.
Yeah.
Very good.
Yeah.
You feel okay?
Fine. Yeah.
So far, yeah.
So far, so good. All right. Thank you, Jeff.
Good talking to you guys.
We'll see you next time.
Next time.